which is Dermo Protectora's range of use. Radiotherapy. To begin with, we are going to talk about oncology patients, those who are diagnosed with cancer and have been receiving radiotherapy. But, which is the current situation regarding to cancer? According to the National Cancer Institute, in 2018, it is estimated that 1,735,350 cases of cancer will be diagnosed in the US alone, and 609,640 people will die because of this disease. The amount of death cases because of cancer is 163.5 per every 100,000 women and men every year. 60 to 70% of patients with cancer receive some kind of radiotherapy. Broadly speaking, radiotherapy is based on ionizing radiation. Currently, there are many new radiotherapy treatments, but even with that, non-tumorous cells are sensitive to radiotherapeutic effects. That is why, in most cases, they are also affected by this treatment. When receiving treatment almost every day, the growth and renewal of the skin cells is limited. After a week of starting the radiotherapy treatment, there may be some changes regarding the skin condition. A lot of these changes usually disappear a week before ending the treatment, but they can also appear after finishing radiotherapy. These changes caused by radiotherapy are called radiodermitis, radiation dermatitis, or actinic dermatitis. This medical complication is common on those patients who receive radiotherapy. Depending on the severity, they can be named as erythema or first-degree radiodermitis, similar to the one caused by the sun's ray, dry radiodermitis or second-degree radiodermitis, third-degree radiodermitis, in which the skin in treatment can get infected, and fourth-degree radiodermitis, which has the appearance of skin ulcers. Why this is our approach at the handling of this entity? Keeping the skin healthy before and after the treatment is important in order to assure the smoothness, softness, and hydration of the skin as well as the healthy appearance. Radiotherapy treatments can be done before or after the surgery or oncologic treatment. For this matter, radiation therapists should work hand in hand with other oncologist specialists. Serious skin conditions could delay the start of other therapies and would jeopardize the result of other surgical procedures. That is why in Venezuela we have dedicated our business to provide samples of this product to several patients in different oncological treatment facilities in Valencia. Also, we developed a protocol which is on the manual for skin care of patients treated with radiotherapy, thanks to the help of Dr. Virginia Castiglia, a radiotherapist on the oncological care unit of La Isabelica. In this protocol, we recommend the application of Dermo Protectora while cold and as a preventive way. It is necessary to start the treatment the very same day the radiotherapy is done, and to keep it going for at least 6 weeks, which is the lifespan of the radiotherapy treatment. Other recommendations, which are part of this protocol, have 4 steps, in which we mention other products belonging to our portfolio, and the ones we pretend to provide the Venezuelan market access to. Patients who are constantly receiving ionizing radiation need to protect themselves from sunlight during the treatment and throughout their entire lives. That is why they need to use sunscreen every day. We recommend the use of soaps with a neutral pH and free of fragrance as well. Those patients who receive radiations around the pelvic area, those who are suffering from cervix, endometrium, or vulval cancer, have high possibilities of suffering erosions or superinfections in some of the areas mentioned before. That is why we recommend intimate hygiene soaps with a neutral pH and free of fragrances. Several institutions took part in this beautiful project. First, we have the Venezuelan Oncology Society, in which I am the president, the Venezuelan Mastology Society, in which I am a member, the Oncological Therapy Institute, ruled by Dr. Virginia Castilla, the Mastology Venezuelan Institute, dedicated to those who suffer from diverse types of breast cancer or other conditions, Funcamama, a non-profit foundation dedicated to the prevention of breast cancer, the Oncologic Institute Dr. Miguel Pérez Carreño, a public oncological center from the central region of the country, and at last, Fundanica, a foundation that occupies a big part of our hearts, a foundation dedicated for those kids with cancer. In the following pictures, we can see an emblematic case. It involves a male patient who is 43 years old and was diagnosed with larynx cancer in its early stage. The best treatment for this stage is radiotherapy. The case reached our hands as we see in these pictures, a case of a second-degree radiodermitis, and because of it was necessary to suspend the treatment. The patient started using Dermo Protectora, and as we can see in the picture, there was a significant improvement in 3 weeks. Consequently, he was able to restart his radiotherapy treatment. Any delays in any kind of oncological treatment can affect the patient's prognosis.